The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hello, all you TMD warriors. We are gathered here for the next episode of TMD Demystified, and I am Tony Urbanek. Today's episode is entitled The TMD and How It Communicates with the Rest of the Body. The TMD and How It Communicates with the Body. Now, this particular episode is going to be a little technical. Maybe if you are viewing this and kind of just interested in slapping in the Urbanek device and protocol, using the protocol and hoping for the best, this may not be the episode for you. But I'm not I'm not lacking for titles or material to cover, that is for sure. But this particular episode is really extremely important for anyone, whether you be academicians or network providers or anyone just wants to learn the truth, demystified truth about TMD. This is an extremely important episode. A little technical, and I have to admit that I'm kind of winging it here based on notes that I made in preparation, and also my basic understanding of different aspects of human anatomy, physiology, biochemistry, cell biology, and of course, it all boils down to inflammation. With that being said, let's try to develop this concept. I will really try to make it simple, though. And again, if you're going to treat and fully understand TMD, you need to understand this concept. And the basic of the concept is this. When the temporomandibular joint, we could generalize it and use this to any joint. That's the big problem about the TMJ. That is the biggest problem. Everybody thinks that this joint is so different. No. It is exactly operates like any other joint in the body. And if you start from that premise, then you're going to understand, and at least you could have the availability, the basics to understand really what's going on here. That's why everybody's been running around in circles for years, decades. All right, so this joint, our temporomandibular joint, can get damaged. Again, very briefly, it can get damaged to chronic bruxism, acute trauma, and functional malocclusion. All three of those cause damage within the joint. Damage within a joint, any joint, including the temporomandibular joint, brings on inflammation. Inflammation is the body's attempt to handle damage and begin healing. That's why, there's so much emphasis put on understanding inflammation. And frankly, we do not understand everything we need to know about inflammation. I'm not even sure we understand half of what we have available to know. But the point is, damage brings on inflammation. Inflammation is the body's response to attempt to heal itself. Common knowledge. Now, with regard to this particular joint and how it affects things, it's no different than any other joints in the body, but the joint itself has three mechanisms that it communicates with the rest of the body asking for help. Basically, let's kind of look at it on a childlike basis. Joint is damaged, begins inflammation, and inflammation is an attempt to heal, but as inflammation begins its process, domino effects of many different things, it literally asks for help from the rest of the body. Now, it has three specific mechanisms that it communicates with the rest of the body, requesting help in this process of trying to heal inflammation within the temporomandibular joint. It uses the nervous system, specifically the autonomic nervous system, specifically the part of the autonomic nervous system called the sympathetic system. So method one is asking for help via the nervous system, the sympathetic nervous system, which is well described, pretty much more often than not understood as the fight or flight symptom. That's the sympathetic system. We'll have a couple comments about that. The second method or direction that is requested for help when inflammation, damage and inflammation occurs within this is through the immune system, which is basically the cellular system. The biochemical response of the immune system then is triggered in many different ways. Some of it we understand, some of it we don't understand fully, but it's literally sending out signals, communication signals through the immune system and the cellular portion of the immune system, requesting assistance. And then the third and frequently forgotten attempt to ask for help when damage is done to this temporomandibular joint is through the endocrine system, the hormones. And we'll touch on that. So there's actually 1, 2, 3 methods or portions of the human biochemical, physiological, neurological systems that once damaged, this joint sends out signals for help. All right, so the first one and the one that we understand more of and that we see more often is through the nervous system. And actually, it has been shown through multiple, I'm not making this stuff up, there are multiple studies that show that the sympathetic nervous system is triggered when this joint becomes inflamed, or generalized, any joint becomes inflamed, which sends a signal through the sympathetic nervous system back to the brainstem, where it's modulated, and the signal comes back out trying to help this joint. And the sympathetic system sends a signal out that says, don't move the joint. And part of the fight or flight mechanism, which can happen in any part of the body, but specifically when this joint is triggered, good word, triggered, then the signal comes back through the sympathetic nervous system to tighten up. And what does that mean? Well, tighten up what? Tighten up the muscles. And that is why some of the most frequent and the first symptoms of TMD, and actually are the most frequent, are headache and neck pain. So the signal comes back out and it says tighten up, fight or flight. If you're going to fight or flight, either way, you need to get your muscles ready. It's like I said, look at it that way, and it makes a whole lot of sense. So the signal comes out and it says, get ready. You know, we have damage here. Get ready. We're going to respond to this damage. Tighten up. And in this case, tighten up means don't move. Tighten up, and it tightens up the jaw muscles, muscles of mastication. We've gone through this before, and that is why when those muscles get the signal to tighten up at various times, various sides, bilateral, ipsilateral, sometimes it's over here, sometimes it's here. And if you can literally trace the origin and insertion of the muscles of mastication, and the patients will come in and they will point to the origin or insertion of the muscles of mastication as the point where it hurts. And it can be multiple points or one point. I had a patient yesterday. She said, the headache is always right here. Well, and the patients will come in and they'll literally go like this. It hurts right here. Well, what is right here? That's the insertion of the temporalis muscle. Muscle tightens up. It gets a signal, a communication signal. We need help. It's inflamed. And the patient will look right there, point right there, or the masseter muscle or the mylohyoid. And one day it'll be here and one day it'll be here. They can't explain it. The medical doctors can't explain it. That's why this has been such a conundrum. Then it gets into the neck, same thing. If the inflammation is not diminished, then the signal keeps coming out. I told you, tighten the jaw muscles, the mastochorial muscles. Now get into the neck, and patients will point to the insertion of the sternocleidomastoid, or literally, they'll point to the back of their head, back of their skull, where the trapezius is inserted. Or I've had some people talk about the scapula, superior portion of the scapula, upper neck, upper back. So we won't go, into detail about that, but it goes on, into the shoulder girdle, headache, earache, jaw pain, neck pain, shoulder pain. But headache and neck pain are the first and second most common symptom of TMD. So if you get this concept through the sympathetic nervous system, inflammation, damage, signals for help, modulated in the central nervous system at the level of the brain stem, signal comes back out, tighten up, fight or flight, and that's the effect. That's what you get. Now, again, to emphasize why it's important to treat it properly, treating it properly is to get rid of the inflammation. If you can get rid of the inflammation, then you don't have these signals for help going out. And getting rid of the inflammation is simply done by unloading the joint. If it's a bad knee, you can unload the joint with a set of crutches. If it's a bad TMJ, you can unload the joint by disoccluding the posterior teeth and using the urbanic device and protocol. Pretty simple when you understand it. The second method, that inflammation and damage and inflammation request help from the rest of the body, as I said, is through the immune system. And the immune system, we are very lacking in understanding it completely. I have read many papers, been an academician, studied to be an academician. Right at the end, I decided not to be a professor in oral and maxillofacial surgery and do private practice, but I trained fully to be an academician and did research with the NIH for 2 years. And so I have some credibility and to speak on these topics. The cellular biology and biochemical response of the immune system is not fully understood. In fact, I don't even know whether we have a really good handle on the immune system. I think it's general consensus among researchers that we do not know anywhere near enough about the immune system. And my maintenance is, when we do understand completely the immune system, that will lead us to, if it isn't itself, the cure for multiple types of cancer, because it's the immune system that kind of triggers these cancerous effects when it breaks down, because we have cancer cells forming all the time, and the immune system handles it. So there's something about the immune system that we don't understand, multiple things about the immune system we don't understand. When we understand the immune system adequately, fully, I think we will have the solution for cancer. In any case, we're not talking about cancer of the temporomandibular joint. We're talking about inflammation, which triggers the immune system and the biochemical response to bring cells in the area, and which begin the healing process within the joint. Now, of course, the problem with the temporomandibular joint, it is impossible to turn this joint off from several aspects. We use that joint to speak, we use that joint to swallow, we use that joint multiple times a day to chew, and for the unfortunate roughly 50% of the population, we use this joint to brush our teeth constantly, day and or night. And literally half the population grinds, clenches, bruxes their teeth, and they have no control over it. And don't let someone try to tell you that they can talk somebody into stop bruxing. The psychological aspect of, and I hear it, I see it, there are courses out there, there are academic institutions that are bringing in psychologists to try to teach people not to brux. Doesn't happen. Patients who brux are going to brux. We know it's more common in stress. Stress is related to bruxism, bruxism related to stress. The more you stress, the more you brux, and you have no control over that. And we are all stressed from time to time, some of us more than others. And we do not even have a definition for stress. But the point, getting back to the point, is the communication that comes from these joints, once inflamed through the immune system, triggers the cellular response to try to heal. But healing of this joint is not going to happen. The best you can hope for is that you can decrease the inflammation by unloading the joint, like you would unload a knee with a set of crutches. That's the advantage and the mechanism of how a posterior disc occluding device works, and hopefully one that you can speak with and you can wear 24/7. You can talk with it easily, and you use it according to an appropriate protocol. And then the third method that the temporomandibular joint communicates with the rest of the body is through the the endocrine system, the hormones. Now that one is unlikely thought of by researchers at this time, although there is significant information about this aspect that's already in the literature. Everything I'm speaking of is in the literature. I didn't invent any of this stuff. So the endocrine system brings on a hormonal response, which has different aspects, again, with trying to bring the different forces to bear, different methods that the body uses to homeostasis itself, to bring itself into homeostasis, health, on whatever topic it happens to be addressed on. In this case, inflammation within the temporomandibular joint, it triggers the endocrine system. On that note, I'm going to read you just a brief, very brief portion of the abstract on this particular article. It's not an old article. It is within Arthritis Research and Therapy, 2014. Interaction of the endocrine system with inflammation, a function of energy and volume regulation. So it doesn't speak to the temporomandibular joint, but it speaks to the interaction of the endocrine system with inflammation. So it applies to what we're speaking on today. We know this joint becomes inflamed when it's damaged. And therefore, here's a very good study, and it's actually a review article on the effect of inflammation on the endocrine system. So let me just go through this quite slowly, and it's only a couple sentences, but hopefully I can make a point. You don't need to take notes, really. But let me just read a portion of this. In chronic inflammatory diseases, a preponderance of energy expenditure pathways is switched on, leading to typical hormonal changes, such as insulin IGF-1 resistance. That insulin resistance, you need to review insulin resistance and all the complications and associations with insulin resistance that can occur. Hypoandrogenemia, basically androgen deficit within the body. What can go wrong there? Hypovitaminosis D, mild corticosolemia, basically cortisol. And cortisol has everything, regulates sugars, and actually has everything to do with weight gain and weight loss. Increased activity of this, and this is the one that caught my eye first, and increased activity of the sympathetic nervous system. So the inflammation triggers endocrine changes, which increase the activity of the sympathetic nervous system, which we already discussed. And the renin-angiotensin-aldosterone system. So these are all regulated by the endocrine system, which is triggered by inflammation. Now, do we know all the aspects of that? No, we don't. And do you need to know all of that? No, you don't. Not if you're treating TMD. But what you do need to understand is what I started out talking about, that this is, you can don't get it really complicated. And if you want to do some, significant research and get yourself published, this would be a good area to do it in as someone who treats TMD. But the point is, you don't have to totally understand it. What you do need to understand is that inflammation, once started, basically triggers mechanisms within the body and asks for help, sends out signals through the sympathetic nervous system, autonomic nervous system, and it triggers the endocrine system, and it triggers the immune system, all asking for different things, modulation of different parameters within the body, which in sometimes has unintended consequences, which we just spoke of. Those are all unintended consequences. So it's a good idea, besides the fact that it gets rid of your headaches, your earaches, your jaw pain, your neck pain, it gets rid of, by decreasing the inflammation, it gets rid of the unintended consequences that are responses of the sympathetic nervous system, the immune system, and the endocrine system. That's the message of today. That is the message. Hopefully you got it, but I'm just going to repeat it. Those three systems are triggered with inflammation in the joint. So why wouldn't you want to decrease this inflammation? And that brings up another point. So why would you, if you have inflammation in this joint, in these joints, why would you want to treat it with Botox that just basically paralyzes the muscles, or dry needling into the muscles that attempt to relax the muscles, or with medication that puts you to sleep, or medication that relaxes the muscles, or physical therapy that does certain activities on the muscles themselves, when you are ignoring the actual cause. And I've spoken on that many times on these episodes of, how inappropriate, let's just call it inappropriate, is to use some of these treatments for TMD. And then you get into the really sophisticated myometric, hooking up the muscles to tins and things like that, when you're just ignoring the actual cause, which then communicates with the body to try to help itself, but also triggers multiple unintended consequences, basically side effects that are not good. All right, well, that is the message for today. I think I tried to keep it simple. I hope I kept it meaningful. And we'll just leave it at that. I just wanted to also, I'm going to try to give a little insight into, when I finish an episode, to give you what we're going to talk about next time. Next week, I'm going to do a episode on the unusual cases and the unusual symptoms that we have found after treating now over 4,000, probably approaching 5,000 in this particular practice, TMD patients, in the unusual cases and side effects and unintended consequences that we have seen within the past few years. The usual and customary have been talked about frequently, but next time I'm going to spend 20 or 30 minutes talking about the very unusual cases and the possibilities that need much further study regarding what has shown up on some of these unusual cases regarding the effects of inflammation within the temporomandibular joint, causing these really weird, considered weird in the medical sense, the usual and customary medical sense, weird symptoms. Enough said. We're going to talk about that next week. So for today, we'll wrap it up with an invitation to look into the Urbanic device and protocol further if you'd like to. You can see a lot more information on our website, www.tmjservices.net. I can be reached at Tony@tmjservices.net, and our director of education and marketing can be reached at Naomi@tmjservices.net. Until next time, I look forward to speaking with you. I am Tony Urbanek, and this is TMD Demystified.